Humanity has seen some really difficult times throughout its history. Wars, famines, economic crises, and natural disasters have all threatened to wipe us out. But even more dangerous than these has been disease. From the Black Death to the Spanish flu, various illnesses have ravaged humanity at different points in history, killing millions and weakening societies. But what are the diseases that nearly wiped out humanity? Welcome to my channel. And today, let's find out about the most dangerous diseases that nearly wiped out humanity. Number 10. Smallpox. Smallpox is an old disease which first appeared 3,000 years ago, and was the most terrible disease for 12,000 years of man's existence. This viral infection had a mortality rate of 30% and left survivors horribly disfigured. The disease arrived in the Americas in 1520 with conquistadors and within a few years killed 10 million indigenous people. When Europeans began exploring and conquering the New World, they brought smallpox with them. Since Native Americans had no resistance to the disease, it spread like wildfire. By the time it reached Florida, it was too late. It ripped through the native populations, killing millions. There were no effective treatments for smallpox. Although inoculation against the disease was developed in China and India in the 10th century, it wasn't until the 1790s that the practice was adopted by Europeans. And Americans, though Edward Jenner, an English physician, is credited with developing the modern vaccine for the disease after observing that milkmaids who contracted cowpox were immune to smallpox. Smallpox continued to break out periodically, killing millions until the World Health Organization declared it eradicated in 1966. Today, smallpox is considered one of the deadliest diseases in human history, responsible for an estimated 300 million deaths in the 20th century alone. No, 9. The Black Death. The Black Death is a horrible plague that swept across Asia and Europe in the 14th century, killing an estimated 75 to 200 million people. It was the deadliest disaster in human history, wiping out half of Europe's population. It was caused by a bacterium called Yersinia pestis, which was carried by fleas living on rats. The disease started in China and then spread along trade routes to India, Persia, Arabia, and eventually Europe. Symptoms included fever, weakness, pain, and buboes, or swellings of the lymph nodes. Most victims died within a week, and the death toll mounted as the plague spread throughout Europe. The Black Death had a profound impact on European society. It led to the decline of feudalism and the rise of the Renaissance, and also helped pave the way for the Protestant Reformation. Number 8. Rabies. Rabies is a viral disease that affects the central nervous system of mammals. It is transmitted through the saliva of an infected animal, usually a dog, and can be fatal if not treated in time. The disease is widespread throughout the world and has been around for centuries. One of the worst outbreaks of rabies occurred in the early 20th century in India, where an estimated 60,000 people died from the disease. In the past, rabies was often called the disease of 1,000 deaths, because of the long and painful symptoms that often led to death. Fortunately, there is now a vaccine available for both animals and humans that can prevent the disease from taking hold. With proper medical attention, most people who contract rabies can make a full recovery. Number 7. Malaria. Malaria is a life-threatening disease caused by parasites that are transmitted to humans through the bites of infected mosquitoes. The disease is widespread in tropical and subtropical regions of the world and has been around for thousands of years. One of the worst outbreaks of malaria occurred in the 20th century in Africa, where an estimated 100 million people died from the disease. Until the 1950s, malaria was a major problem in many parts of the United States, but it was largely eliminated through mosquito control measures and the use of insecticides. Today, malaria remains a serious public health problem in many countries, but there have been significant efforts to control the disease and reduce its impact on human populations. These efforts include developing new drugs and vaccines, improving access to diagnosis and treatment, and continuing to fight mosquitoes that spread the disease. While there is still much work to be done, progress has been made in the fight against malaria, and we can hope that one day the disease will be eradicated. Number 6. Yellow fever. Yellow fever is a viral hemorrhagic disease that is transmitted through the bite of an infected mosquito. The disease is prevalent in parts of Africa and South America and has a long history of causing epidemics and pandemics. One of the worst outbreaks of yellow fever occurred in the 19th century in the United States, where an estimated 150,000 people died from the disease. However, the development of a vaccine in the 20th century has greatly reduced the incidence of yellow fever, and it is now rare in the United States and many other parts of the world. Despite this progress, yellow fever continues to be a threat in some areas, and it is important to continue efforts to control the disease and protect populations from its effects. These efforts include vaccination, mosquito control, and public education. Number 5. Typhus. Typhus is a bacterial infection that is spread by lice or fleas. It causes high fever, headache, and a rash, and can be fatal if left untreated. During World War II, typhus was a common illness among soldiers on all sides, and it is thought that up to 20 million people died from the disease during the conflict. In the past, typhus was often found in crowded and unsanitary conditions, and it was particularly common among soldiers during wartime. The disease could be spread through contaminated clothing and bedding, and it often led to epidemics in military camps. With the development of antibiotics in the mid-20th century, typhus became much less common. Today, the disease is still found in some parts of the world, but it is rare in most developed countries. Number 4. Plague. The plague is a deadly disease that has ravaged humanity throughout history. The most famous outbreak occurred in Europe in the 14th century, known as the Black Death, which killed millions. The plague is caused by a bacterium called Yersinia pestis, which is spread by fleas living on rodents. The disease can cause fever, weakness, and painful swellings in the lymph nodes. If left untreated, the plague can be fatal. In the past, the plague was a common occurrence in many parts of the world, especially in areas with poor sanitation and overcrowding. Outbreaks were often linked to rodent populations, and the disease could spread quickly through human populations. With the advent of modern medicine and public health measures, the plague is now rare in most parts of the world. However, cases still occur from time to time, especially in areas with limited access to healthcare. Number 3. The Great Plague of London. The Great Plague of London was a devastating outbreak of bubonic plague that occurred in the city of London in 1665. The disease, which is also known as the Black Death, is caused by bacteria and is spread through the bite of an infected flea. Symptoms of the plague include fever, weakness, and painful swellings in the lymph nodes. The outbreak began in the summer of 1665 and quickly spread throughout the city. As the disease progressed, the death toll mounted, and entire families were wiped out. The authorities took measures to try to stop the spread of the plague, such as closing businesses and banning public gatherings. However, these measures were not enough to contain the outbreak. By the following year, the plague had killed an estimated 100,000 people, which was about 1 out of every 5 Londoners. The Great Plague of London was one of the deadliest outbreaks of bubonic plague in history and had a profound impact on the city and the course of human history. Number 2. The Third Cholera Pandemic. The Third Cholera Pandemic was a devastating global outbreak of the disease that began in 1852 in India and spread rapidly across the world. Caused by a bacterium, the disease is characterized by severe diarrhea and vomiting, which can lead to dehydration and death. The pandemic was particularly deadly, claiming an estimated 1 million lives worldwide. The disease spread quickly through water and food, infecting people of all ages. The mortality rate was incredibly high, with up to half of those infected dying from the disease. The pandemic had a profound impact on the world, causing widespread panic and fear. Public health measures were put in place to try to stop the spread of the disease, such as quarantining the sick and disinfecting water sources. Despite these efforts, the pandemic raged on for several years, causing immense suffering and loss of life. Eventually, the pandemic began to subside, but the disease continued to circulate in different parts of the world. The Third Cholera Pandemic was a turning point in the history of public health, leading to major advancements in our understanding of the disease and the importance of sanitation and hygiene. Number 1. COVID-19. The COVID-19 pandemic has been a devastating global health crisis that has affected nearly every country in the world. Caused by a coronavirus called SARS-CoV-2, the disease has resulted in millions of deaths and widespread illness. The pandemic began in late 2019 in Wuhan, China, and quickly spread across the globe. The virus is highly contagious and can cause a range of symptoms from mild to severe, including fever, cough, shortness of breath, and loss of taste or smell. In severe cases, the virus can lead to pneumonia, acute respiratory distress syndrome, and death. The impact of the pandemic has been felt around the world, with countries implementing lockdown measures, closing schools and businesses, and canceling public events. The global economy has also been significantly impacted, with millions of people losing their jobs and businesses struggling to stay afloat. Healthcare systems have been pushed to the limit as hospitals have become overcrowded and medical staff have been working tirelessly to treat patients. Despite the challenges, there has been a tremendous effort to develop vaccines and treatments for COVID-19, and as of 2021, several vaccines have been approved and are being administered around the world. The COVID-19 pandemic has been a devastating global crisis, but the scientific and medical communities have made incredible strides in understanding the virus and developing treatments and vaccines. As we look to the future, it is clear that the pandemic will have a lasting impact on our world, but we can hope that we have learned valuable lessons about public health and the importance of global cooperation. Which disease scares you the most? Let us know your thoughts. Thank you for watching. See you next time.